you could welcome everybody. We are recording as always. We're doing another TuttleTalk as a podcast, and this is one that is very pertinent with everything we've been going through lately. So first, I just wanted to, as always, say thank you for everything you're doing. There is a light at the end of the tunnel. We're past the 100-day mark of school for everyone who did those projects with the kids and made it through. It's St. Patrick's Day. It's sunny out. It's good. We're getting there. And so, in case you haven't heard it today yet, thank you for everything you're doing for the kids in New Hampshire, whatever your role in the school is, because we know that every single role is vital and every role is crucial to making a child's education the best it can be in a whole education. So hopefully you're going to be able to share this podcast later, but as you know, the vaccinations have opened up and a lot of districts have already had their kind of closed pods for them, but we've been getting questions, and so we wanted to kind of open it up and see what we could answer for you. And so tonight we have two people with us. We have Jim Potter, who is the executive director, the VP, and the CEO. We can take our pick of what we want to use for the New Hampshire Medical Society. And we also have Pam Clay-Storm, who is a school nurse at Kennett High School. But aside from that, and her role tonight, she's here from the New Hampshire School Nurses Association. And we work with the association on a lot of bills that go through the legislature. So, they're not something that's, they're not a group that's foreign to us. And as a mom of 3 boys, I so appreciate the school nurses. You have no idea. So we've had some questions already come up. Excuse me, that's Brinley. She hasn't gotten her treat yet for the podcast. Cindy knows that every podcast and TuttleTalk, she gets treats to keep her quiet. But really? I'm going to turn it over to Jim and Pam while I get Brinley a treat. And so thank you. And I think we're leaving the chat open tonight. Is that correct, George? Okay, so we're going to leave the chat open. So feel free to ask questions as we go through. And excuse me a minute, I'll turn it over. So welcome, and I'm so glad you could be with us.
Thank you. Thank you very much. We'll get started here. Want to welcome you for this session on COVID vaccine information and a question answered toward the end. My name is Jim Potter. My colleague here is Pamela Clay-Storm, who is a school nurse at Kennett High School and representing the New Hampshire School Nurses Association, as mentioned earlier. We're going to, this is part of an overall effort of what the Medical Society, in conjunction with the Business and Industry Association and the Hospital Association, has been doing since early December. And we worked with the New Hampshire Division of Public Health Services to develop a mission and some goals on how essentially various stakeholders across the state could help promote vaccine confidence, support consistent vaccine messaging, and then help foster coordination of the vaccines allocation process. And to do that, our goals are to promote public buy-in, to help increase immunization rates in the state. Most importantly, we try to act as a force multiplier for the state's vaccine communication and allocation plans. At times, we will counter misinformation that comes out. And our last thing is, which we started just to do this past week, is we're starting to foster use of the new immunization information system. And that's a process that they're going to be changing over in the next month, where practices, offices, hospitals get vaccine supplied to the state, and then they report that in. So we have what essentially is a new vaccine registry. We are the last state in all 50 states and a couple of territories to have a vaccine registry. So we're finally standing one up. This has been supported by a number of sponsors that you can see on the screen. That's allowed some of my time to be kind of devoted to this particular project. Overview of the program tonight. First of all, we want to let you know that questions about vaccines are a good thing. And we want you to have your questions answered. The reality is you can't be forced to take a vaccine, nor would we want you to. But we want to try to answer those questions. And we'll talk about why that's important as we go through. And then widespread spread vaccine use, getting the vaccine, is about really getting back to life. Folks will say, well, we're going to get back to normal. I'm here to tell you right now, there's not going to be a normal. We're not going to get back to pre-pandemic. And I'll say, everybody has one of these right now. Now, if you're around 20 years ago, nobody had these, or not many, and we didn't think of them as something that we'd use. This changed our lives. We use it every day. So think about the pandemic in the same way. Our lives are going to be changing, and it's not necessarily with the inset of the vaccines. We're going to be with this pandemic likely in one form or another for a couple of years as we kind of move through this and better understand it and can move out of it. So it's really getting back to those moments that you missed with your students, with your family, with your friends. It's those things that you miss that we're getting back to those things about life. That's what really getting the vaccine is about. So we're going to then cover a couple things about some FAQs that you will receive or have access to, and that we worked with the school nurses to develop, that kind of take on some other frequently asked questions that we often hear. We'll also try to answer some of your questions. So it'll be a Q&A time, and I think you'll be able to put your questions into the chat or the Q&A section. And finally, we'll just talk in a broad sense about how to register during phase 2A and what you'll need to bring through that process. And there'll also be some handouts on that I think will also be part of the materials. So jumping into it, I'll turn it over to Pam.
Thank you, Jim. And first of all, let me just thank the NEA for inviting the New Hampshire School Nurses Association to join you on this discussion. It's my honor to be here and to present some of this information to our colleagues in our schools that we work with every day. So I just thought I would start with this document that Jim referenced, how it came to be. So your school nurses have been working, as all of you, tirelessly to help develop mitigation strategies and manage COVID cases in school. And thankfully, we're at this place where we are talking about vaccine and vaccination for all of our staff. So in the lead up to opening the K-12 staff vaccination sites and registration, the school nurses started wondering and thinking about how we can best support that effort and provide answers to some of the commonly asked questions that we were hearing from our teachers and our other staff members in our school. So we drafted a document with some questions on it, and fortunately, had the opportunity to partner with Jim and the New Hampshire Medical Society to really fine tune not only the questions, but the answers to those questions, so that hopefully we've touched on, most of the common questions that have come to us. But we welcome, as Jim mentioned, any question that you might have, and do the best that we can to either get an answer for you or answer that question. One thing I have learned in this year of COVID-19 is all documents are essentially draft form. They are all subject to change at times. COVID has been a rapidly evolving situation, as I know you all know. So this document is no different. There are some answers and some questions on here that have actually been updated even an hour before we came on. So we can discuss some of that particularly related to the quarantine for travel outside of New England. Question number 6, you might see there, has been updated as of this evening. So we can go through some of those maybe more updated guidance that has just come out towards the end of the discussion. But I just wanted to, make you aware that there are some things that will constantly need to be updated as we learn from the science of how things are evolving, and essentially the good news that we're hearing regarding schools and transmission, and also the rollout of the vaccines and how successful they have been. So I'll leave it at that, but I wanted to make sure you had access to this document, and we will address some of these questions now as well.
Great, thanks, Pam. So the first question really came up because in the schools we have a lot of teachers who are childbearing age. The question goes in a little bit more depth, but first, this is widely accepted. The vaccines are promoted by the American College of Obstetricians and Gynecologists, Society of Maternal Fetal Medicine, as well as the CDC. So they're recommending, advising that pregnant women and lactating women should get the vaccine, even though the clinical trials did not specifically include those two groups. So think about the vaccine working to train our bodies to develop antibodies and to prevent future infection. That's really what that's what any vaccine is doing. First thing I want to tell you is the vaccine, it's not a live virus. And what it does is it breaks down quickly. And we'll talk a little bit about how mRNA or messenger RNA vaccines work a little bit more in detail a little bit later. But they break down after essentially quickly your body's immune response starts. Most important thing, the vaccine will not cross the placental barrier. And so it will not reach a fetus, your baby. However, and this was actually verified today in the first case, protective antibodies do pass through to your baby, through the placental barrier and through breastfeeding. So what came out today is there was a healthcare worker that got a vaccine 36 months. 3 weeks later, she had her baby, about a week after they tested the baby, and that baby has antibodies. And we don't know how much more about that, but this is a very good thing. So it can actually afford, while you're nursing and while your baby is developing, some level of protection. The details on that we don't know, but it confirms what we thought was going to happen. Also, there's no evidence to suggest that there are fertility problems or side effects from any vaccine, particularly these COVID vaccines. And the other thing I think everyone has to think, you have to think on both sides of this. Contracting COVID while you're pregnant, you have a much increased chance of severe illness for both you and your baby. And so you have to weigh that information given that there's not conclusive evidence right now. And that's what we want you to do is think about things as a whole, not one side or the other. Next issue, go ahead, Pamela.
Yeah, so another really common question that we might hear is, well, what if I have allergies? Is this safe for me to get the vaccine? And the very short answer is yes, for the most part. Even with certain allergies, it is considered very safe for you to receive the vaccine. The vaccines are not developed with preservatives and eggs, which is something that some folks are oftentimes concerned that might trigger an allergy response. And I think this question came because a lot of our focus in the beginning might have been on the attention that there had been some rare, severe allergic reactions to the COVID vaccines. But as you can see there, that situation is generally speaking very rare. 4 cases per 1 million doses. So that is something that the vaccination sites are prepared for. So if an individual is going, they are certainly prepared to manage any type of allergic reaction at the site. So be comforted in that component. But again, this is a very rare reaction to the vaccines. If a person does have a severe allergic reaction, there may be some conversation about receiving the second dose of the vaccine. So I just do want to make sure that that's pointed out. If an individual, one of these rare occurrences happen, it may be that there'll be some conversation about whether or not it's real appropriate to have the second dose of that vaccine. So what if, I'm just going to mention
Sorry.
one last thing about that. If you have a history of a reaction to another injectable or another vaccine in your past, it still may be very appropriate for you to receive the COVID vaccine, but we will have some precautionary measures in place. So ultimately, you want to consult with your doctor if you have any specific questions of whether it's safe for you, and that monitoring will be occurring at the vaccination sites. For those of you maybe who haven't gone through the process yet, they do monitor everybody for 15 minutes. And if there are red flags for needing additional monitoring, that does occur. So just to end there, and I'll pass it on to you, Jim.
Thank you. A next question that often comes up, what are the possible side effects after the vaccination? So the most common ones are some injection site swelling, pain, fever, chills, tiredness, or headaches. Some other ones are muscle and joint pain or swollen lymph nodes. So I'll tell my wife, on the arm that she got a vaccination, she felt swollen nodes up on the same site in her neck. And generally, these occur within the first 3 days and typically last for 1 to 2 days. Now, I will tell you, full disclosure here, I was in the AstraZeneca trial here in the US back in November. I got that, and that's when I experienced a little bit of those, all those symptoms, a little bit stronger on the second dose, which is common. I will be one to sign up. I'm over 50, so I will be signing up next week for one of probably the mRNA vaccines that will be available. And I'll take it willingly, even knowing though my first dose, I'm probably going to get a pretty good reaction because they're going to go, your body's like, oh, more of those things coming, and so there will be a reaction, but the reaction is a good thing. It means actually that you're having the immune response, that your body's producing those antibodies. So when you're going through those symptoms, that's a very good thing. And then, as we mentioned, severe adverse effects are only to about 4 per million. And I'll just mention that in the last 2 months, actually that number has come down. I think when it first came out, it was 9 or 10. And then, a week ago it was 5, and then it's come down. So as we have more experience, it's showing that this among vaccines is probably one of the better ones for the least amount of severe reactions.
So another question related to that. So if you are having side effects after the vaccine, after your dose, do you need to stay home and do you need to go get a COVID test? That's a very natural question to have. If you start feeling symptoms, your school nurse has probably been telling you to please stay home and talk to your doctor about getting a COVID-19 test. So if the initial side effects occur, as Jim mentioned, really that's your immune response. That's your body just trying to develop those immune protections for the virus. This doesn't necessarily need to keep you from, attending work or other activities. However, just as we say, anytime, please stay home if you're having a fever. And of course, if your symptoms are severe or uncomfortable enough, you should probably remain home and rest. But if you have a sore arm, as I did when I had my vaccine, I predominantly had a really sore arm, you're probably going to be able to return to your workplace. These symptoms should resolve quickly. If they are respiratory symptoms or you're experiencing loss of taste and smell, which were not a part of that side effect profile that Jim just shared, those are really not typical reactions to the vaccine. Or I would add, if they're going on, they're persisting, they're going on for more days than you would anticipate, then we would absolutely recommend that you contact your healthcare provider and seek a COVID-19 test and follow all the protocols that are in place in your area for quarantine and possibly contact tracing if needed. So
Can I just jump in there a second?
Sure.
If you have any questions about if you have to, or if you can't work remote, anything like that, check with your UniServe director. just because there may be the chance for you to stay home and work remote, depending on if it's sick time you have to take, if it's sick time that you can get, that can be reimbursed through the district for other, through CARES Act or anything like that. So if you do have questions about that piece of it, the logistics, not the medical piece, that's not my, that's not my area. But if you have questions about the, logistics of it, check with your UNICEF director, and they will be able to guide you through that.
Thank you, Megan. We're going to jump in real quickly to a little bit of the overview of the messenger RNA vaccines, the Pfizer and Moderna. The reason we're talking about these is because these are very, very likely the vaccines that you'll receive through a phase 2A. The Johnson & Johnson or the Janssen vaccine is not in a lot of supply right now. And it's very likely when the state gets some supply towards the end of the month, and they're going to probably roll it all up into one of these kind of mass vaccination sites. So if you're registered and you're not part of this, then you might get a call from 211, and they'll say, would you like to move up, or if it's appropriate. But we'll have to see how that, so it's likely going to be one of these two vaccines that you'll get. And the mRNA is what it causes our cells to make protein. So the vaccine is injected into your arm muscle, and then the mRNA basically instructs the muscle cells to produce a certain kind of spike protein. And the spike protein is found outside the COVID-19 virus. So once our immune system sees this spike protein, then it produces antibodies and rushes them towards that. And thus, what happens is it teaches our body to make antibodies to the COVID virus. So if we're affected, you essentially get a jump start. Your body says, oh, it recognizes it early and it gets a jump start. And that's important with this particular virus. It's when the body is slow in reacting, those who have autoimmune disorders, who can't own responses, aren't as quick, those are typically folks who have had more trouble, have to be hospitalized. And so the vaccine is really important because it really gives you your own immune system a jump start if you're exposed to the virus. Just a couple of things ago, again, it's not a live virus, so you can't get COVID-19 from one of the mRNA vaccines. And the vaccine doesn't affect your DNA, so it never interacts with your DNA. Once the cells are used, our bodies again kind of break that down very quickly. We talked about earlier that it wouldn't reach a speed of such, but it really does break down pretty quickly the actual vaccine with the mRNA. So to make the differentiation, the COVID-19 virus is not a DNA virus. Now, a DNA virus that you might see is the HPV or the human papillomavirus or genital herpes or chicken pox. Why those DNA viruses are dangerous, because they can trigger cancer cells in your body over time. And that's why we try to promote vaccines for HPV at a much younger age, because of the risk of cancer with younger women. I'm just going to go over efficacy because some folks kind of struggle with this. So I'm going to talk about one clinical trial. The Moderna vaccine had more than 30,000 study participants. In all of that, 185 had COVID or COVID positive in the placebo group. And typically what they do is they divide them roughly in half. So one half gets the vaccine, the other half gets a vaccine, placebo, sugar water. And so what happened is 185 were positive in the placebo group. 11 were positive in the patients with the vaccine group, meaning that they contracted, or they basically shown that they had COVID vaccine in their blood system. They tested positive. And so the way you calculate efficacy is you take those out of the same pool of the 185, you go 174 over 185, and you get 94.1. And so the Pfizer is 95% effective, is what it's generally through the clinical trial. That means out of the same kind of bolus or the same sample, about 5 out of 100 will essentially are likely to at least contract. But these are typically minor cases. You may not even know it. And the best thing about this too is you're much less likely to spread the virus. So even after you have it, what happens is essentially the COVID virus that builds up in the mucous membranes of your nose, and when you sneeze or dispel that or you're breathing, that's how the virus is mostly transmitted. That's what scientists believe right now. And so when you have the vaccine, there's much less COVID virus in those nasal passages for you to be able to pass. And so this is, it also not only protects yourself, but it protects everyone about. So it protects your students, it protects your family, it protects your loved ones. And that's why when you get vaccinated, you have the ability, we'll talk about a little, to go back and to re-enter those situations. Maybe you haven't seen mom and dad for a year or some time. The next thing that's really important here is severe death in cases. So in the placebo group for the Moderna vaccine clinical trial, they had 30 severe cases. However, for those who got the vaccine, they had 0 serious cases, 0 deaths. And so that's where you hear the other kind of important statistic here. That's really what we're trying to achieve in all populations, so you don't get severely infected with COVID. That's the big thing that the vaccine does. This is about as close as you get to a miracle drug. If you look at any other vaccine, they don't come to these numbers as we're kind of talking about right now. And keep in mind, I'll just kind of go back. I just kind of make a note. You may hear varying numbers. That's because these randomized trials were done at different times with different patient populations, different regions, at different time intervals. And so it's comparing them broadly, if you get way into the weeds and look at some of the studies, is a little bit more tricky. But generally, those are the 2 numbers you want to be looking at. So with that, what we thought is we turn it over to some questions that you might have. And I guess we'll just take on a couple of these. The one question was about variants, and the question of what about the variants? Will these vaccines cover the various variants that are coming in? And there was an interesting study that just came out today that talked about the UK variant, and that's called B1.1.7. But it started in the UK, so that's also called the UK variant. And the British Medical Journal basically came out and said that the risk compared to the variant that is predominant in the US is about 40 to 70% more transmissible. And then it's 60% more likely that you're more likely to die from the UK variant. We didn't have that information before, but that's what this new British study kind of came forward. Why this is important is because the variant right now, if you think, well, everything's going down, everything's going to get better, and because that maybe I really don't need to get this. Well, I think you have to be careful about that kind of thinking, because it's very, very likely that we'll see one, if not all, these variants come into the United States. And they will go into populations that basically they're feeding. So I expect what you'll see is those who don't get vaccinated by summer, those are likely to be much more susceptible to these other variants, whether they're from South Africa or Brazil or the UK. And that's where I think you'll see, I'd almost bet you'll see a surge or a forced spike sometime later this year, but it will be predominantly among those who chose not to get vaccinated. Pam, do you want to take a question? And do we have, go ahead.
Well, I'll throw a question out there that might just feed well off of what you just said, which leads to, what can fully vaccinated individuals expect that they can or cannot do after they're fully vaccinated. So I think this is a really important conversation. I think it's evolving. Things are going to change as we learn more and more about the vaccine after people are, vaccinated, whether or not we feel more and more confident that they're not able to spread the virus. But as it sits right now, I think it's important that we remember that we are still going to be, wearing our masks, using our mitigation measures that we have in place. All of those layers are still really, really important in our school settings. And, hopefully that will evolve and change. But as of now, when you are a fully vaccinated individual, and what do we mean by that? That means after you've either received the second dose of one of the mRNA vaccines, you are 14 days past that, or if you do happen to receive the J&J or Johnson & Johnson vaccine, you are 14 days past, which is a pretty common time frame we hear with any vaccine. It takes the body about 14 days to feel confident that we have enough of an immune response built up. So once you hit that mark, we are advised that you will not have to quarantine if you are exposed, considered a contact. So that's an important distinction. And again, with travel, we, certainly we're saying that individuals who are fully vaccinated were not required, at least by the state of New Hampshire, to quarantine after travel outside of New England. As I mentioned early on in the call, though, that the guidance from New Hampshire has just changed, or updated, I should say, today, that they are not requiring quarantine for domestic travel. They are still going to be requiring quarantine for international and cruise ship travel for individuals who are unvaccinated. So there is some new guidance out there, and I can direct you to the newhampshire.gov COVID website to kind of find that updated guidance. But I think what's really important to take away from all of this is that vaccination is one of our probably the best layer of protection we're all going to have, but we are still going to have to be mindful out in public and in our schools that we are continuing to use those prevention measures. As Jim mentioned, the variants are, certainly something that are being watched closely, and we want to make sure we're not, relaxing our guidelines at this time, continuing to stay vigilant with our precautionary measures. The CDC, just to add to that, did come out with some guidance for fully vaccinated individuals that they are able to visit in private homes, households that also are fully vaccinated, and enjoy that long-awaited hug maybe with a family member. And even if they're visiting perhaps a neighbor low risk in their home, they can also, if they're fully vaccinated, relax a little bit of that. But as of right now, with schools and businesses and being out in public, we're still strongly encouraging all of those mitigation measures remain in place.
Great. Another common question that we often get is, if I tested positive for the COVID-19 in the past, do I still need to get vaccinated, or do I have enough antibodies? And the answer is yes, absolutely. As we just kind of talked about, because of the severe health risk, reinfection, particularly with other variants, is very, very possible. And not only possible, but probable. So you want that immunity from the vaccines. And it's likely over time that they will develop a multi-variant vaccine of the mRNA. It's pretty easy. This is something they do with pneumonia vaccines and measles. So those two, it's actually a number of variants that are mixed together for the current vaccine. And I think that's, if they come up with a booster, that's probably what it will look like, whether that's a year or 2 years down the line. The other question is, if I currently have COVID or tested, how long do I have to wait to get vaccinated? And typically criteria is about the time that you meet the isolation criteria. So at least 10 days since you've had symptoms first appeared or had a positive test if no symptoms, and fever-free for at least 24 hours, free of using any fever-reducing medication or improving the symptoms. The other thing is, if you've been tested for COVID-19 with, they call it monoclonal antibodies, or you have had convalescent plasma, then you need to wait about 90 days before getting the COVID vaccine. So that's if you had it and you've been treated by one of those two treatments, you want to wait about 90 days. Other question? Does anyone online have a question that they'd like to maybe have answered?
I'd like to ask about distancing for those of us who are vaccinated versus those who are not. Has that changed anywhere?
Jim, do you want me to take this?
Please.
As far as vaccinated versus not, I would say in the school setting, no, because again, remember all of our layers of protection, just, providing distancing, hand washing, staying home when you're sick, wearing a mask are all still in play. What I understand, and please bear with me because it just came out about an hour ago. So, New Hampshire's public health has always had a 3 to 6 foot acceptable distance. Obviously, maximizing distance is of their of preference in school setting. I'm going to refer to it in the school setting. However, we are now looking at how we're going to identify contacts of a positive case a little bit differently. So since the beginning of when we've been here at our school, we were looking at 6 feet distance as an individual who tests positive. We look at those individuals that meet the criteria of been within 6 feet for 10 minutes or longer over a cumulative period of time. They are now looking at 3 feet as being a reasonable, acceptable measure as opposed to the 6 feet. So public health, as I understand it, is going to be looking at individuals who are really within the 3 foot distance from a positive individual as a close contact. So that is how I'm interpreting the change at this moment. Again, I certainly would refer you to the new HAN that just came off the presses, HAN number 38, which is a Health Alert Network notification, and that spells out all the newest guidance. And Jim, I don't know if you want to add to that at all, or if you have any other.
I just have a question about the HAN. Where is that information coming from? Who is putting that out?
So that's a great question. Yeah, that's so you can go to essentially the Department of Health and Human Services. They have a vaccine information page, and so all the HANs related to vaccines appear in that area, and you'll see them more towards the bottom, but has all the various background information that you'll need about the vaccine, and you'll see them listed out. So if there's any previous HANs that you want to take a look at, there's good information there too. But we'll make sure that link is provided to the NEA members so that you can reference that for yourself, or we'll just get you the document.
Okay, is this Department of Health and Human Services, is that the New Hampshire, or is that federal government? It's New Hampshire.
New Hampshire Department of Health and Human Services.
Okay.
It's in fact, I can probably pull it up. I hope.
Oh, that's okay.
That's right.
I want to know what is the difference between the CDC guidelines, which is coming from the federal government, versus the state of New Hampshire?
Typically, the CDC will come out with its guidance on a particular issue. Then Dr. Chan, Dr. Talbot, Dr. Elizabeth Daly will look at that, and they'll judge, is that appropriate for New Hampshire? What's different about New Hampshire and New England? How are we different from maybe Florida and Texas? And so how should those particular guidance be applied? Oftentimes they're close, but sometimes there are some significant differences because in New England, we're not the same as what other states are experiencing right now. Good question.
And if I just add to that, Cynthia, you know, also from there comes your school district really interpreting information and kind of applying it to their setting as well. As we probably all know, that's happened throughout the course of the reopening guidance that's come out. So I think that's an important piece too.
We just had a question in the chat also. Does a 3-foot distance include masks and PPE?
Yes. So thank you for bringing that up. Yes. So when they're looking at a contact, they're using the context that individuals are masked and in the setting that they're identifying the contacts, not an unmasked setting. And also there's some nuances to that. Again, I would refer more to the direct language in that guidance document, but you know, it's a controlled environment, so to speak. So it's an environment where, you know, not necessarily is there, you know, a lot of uncontrolled action, best way to put it, I guess you could say, where it would be very difficult perhaps to say, well, were they within 3 feet of each other, because this environment might be an uncontrolled setting. But in a setting where you might have seated classroom, where individuals are certain feet apart, it makes it a little bit more of an opportunity to determine if somebody was in that sphere that they would consider a close contact.
Right. We thought we'd close by just quickly going over the allocation policies for the 2A phase. I'm gonna go right back. I gotta go right back down to right here. Sorry. So really 3 ways to obtain the vaccine. One is what we've talked about, a school district SAU clinic that's a closed pod. And many of those are happening. It's not necessarily that they all happened last week. Actually, they're going to probably happen for, you know, I think the remainder of March for some of those to get first doses for some of these closed pods because the regional public health networks also have some other responsibilities that they're taking on. The second is opened up this morning through https://vaccines.nh.gov. If you go to that and through that process, you'll go to a state or a hospital run clinic through the new VINI, which is the NH Vaccine Immunization Network interface. And if you can't, for whatever reason, you can't get through there, you can access the same registration process for those state or hospital run clinics through 211. You'll call up and they'll take care of you there. The new VINI system in 211, it used to be you had to give up in phase 1, you had to give up your appointment first under VAMS. Now you don't. Now you can call them up and say, listen, I'd like to change the time. Oh, I just want to verify this time. They'll do all those. So this system is a lot more flexible. The other thing that you have to do is once you've got your appointment, but typically for all these, this is what's recommended. Closed pods they probably know you. So you might only have to present your driver's license. But if you're going to one of the public or hospital sites, then you're going to have also, besides your driver's license, one verification form. So that's your photo ID card from the school. It's a payroll check or document within the last 60 days stating that you're employed in the school. or it's a letter or even an email. Sometimes they'll accept from the school on the school letterhead. So those are three things that you'll want to kind of just think about as you go for those appointments. So that wraps it up. Oh, one more question that we had is it said Walgreens doesn't allow people in New Hampshire to make appointments directly. Will that change? Walgreens right now is under a federal contract, and I think what they're doing, focusing right now, is mostly on the phase 1B. So those individuals that are 65 and older or are medically vulnerable. So I believe they're largely using those in the Walgreens because they're a little easier to access to go into those, or they're sending them to one of the public sites. My sense is that within the next month that their mission will change, and that some of these public appointments, you might get an offer to either move it up or to change it to one of these Walgreens locations. But you just have to look and see at the time to see if those kind of locations are available and when they're available. So
Jim, we have one more question in the chat.
Yeah, great.
Yeah, and maybe you can help chime in on this one. It said, if after having 2 vaccines with no reactions, does this mean you do not have many antibodies?
That's a great question. Typically, those who have some kind of autoimmune disorder, or we've seen those who are older whose immune systems aren't maybe as robust as they were, it usually takes a longer period of time to develop those antibodies. Typically, though, they're within about a month period. So when you've seen from the studies, it's usually after about 20, it's usually 14 days, but what you'll tend to see is actually kind of full effectiveness goes out to about a month. And so it's really most of the antibodies are produced in the first 14 days. But if your system's a little slower, then it may take up to that month or maybe a little bit longer to develop kind of your full response.
Just to let you know, I have cancer, so I have a suppressed immune system. I got my first shot the last week in February. It took a week for me to have a reaction.
Yeah, that's real important. There's actually just a study out today that said it's actually those who are on immunosuppressant regimens, drugs, therapies, that will slow down the process. One question that kind of comes up is typically too, we get asked is it okay for me to take aspirin or an Advil or the day before, just before I get it? And the answer would be no, it's probably not, because anything that slows down the immune response, you probably don't want to do initially. If you have symptoms, if you have a fever, if you have a lot of body aches, say a day or two after, then yes, use what you need to help moderate that achiness or the fever. That's appropriate. But taking it just before or the day before is, if you don't need it for symptoms, then don't use them, is generally the answer. Hey, Pam, you want to add to that?
I would just add that another common question on top of that is, can you take your regular medications, prescribed medications? And for the most part, the answer is yes, you should take your regular medications prior. You don't necessarily need to, you don't want to halt those. However, if you had questions about particular medications that you are on, obviously we would recommend you consult with your own healthcare provider. But in general, you want to be able to take your own medications that day of the shot. But as Jim said, not pre-medicating. I even read today, not even with an antihistamine like a Benadryl, in case you're worried about getting the red or little itchy arm that can happen. They recommend not doing that either. You want to give your immune system the best chance it has to develop that antibody immune response. So
yeah. So 2 good sources. You can always go to your healthcare provider, your physician, or another great source is that you have in every school is your school nurse. They all are well versed in this. They all have this information. And if they don't know the answer, then they'll know who to reach out to get that answer that you have. So for teachers, school faculty, staff, school nurses are fantastic.
Why, thank you.
Yes, they are. For so many other reasons too. So thank you both for taking the time tonight to answer the questions. If we get more questions, we'll go from there. There's another one. If you do not have a reaction, would you suggest an antibody test? Did I get that right, Nancy?
Yeah.
Okay.
No, go through, if you have, don't do the antibody test only because it costs and your antibodies are still building. So it takes some time and it's not fully effective until you have both doses and then at least 14 days afterward. I only know that I have antibodies from that I'm not in the placebo group is because I had to travel out of state for a funeral. And so we thought it best, and I consulted my physician. They said, yeah, you should get it just so you have some peace of mind. But generally, no, you don't want to get an antibody test within, at least, I would say about 45 days or more after your first dose. It won't really tell you anything beneficial. And in all likelihood, yes, if you get one of the mRNA, you're going to have antibodies. There's not too many cases where that doesn't happen. And as we mentioned earlier, if you're pregnant or you're lactating, those antibodies are good things that can be passed to your babies. So again, that's a good thing for them, and the science will probably be borne out over the next couple months on just how effective or how long that lasts for that population. The last thing that we'll probably talk about is kids in school. And so it was just announced that they're starting to do the clinical trials for children under the age of 18, and they're going to break those up in a couple of different cohorts. But my understanding is they will go down to as low in the clinical trials during the various phases down to 6 months of age. So they're going to be looking to that. Reality is that clinical information probably won't be available till probably early next year. My guess would be the next area that they might look, and this will be the first ones that they try to do the clinical trials, is probably for adolescents. So I think the focus probably in the fall will absolutely be, making sure all college age students are getting it, and those, probably in high schools. Probably if there's going to be a next target population, that would be those two groups, I guess, in the fall.
Great. So yeah, thank you for taking the time tonight. I think there was so much valuable information for the members, and we'll have this podcast posted so you can share it with the members in your locals. And any other questions, as always, let us know, and we will keep getting information out to everybody. So one last time, thank you for everything you guys are doing in the schools. Thank you for everything, Jim and Pam, that you're doing outside of the schools and in the school, Pam. Yeah, we'll go from there. So hopefully everyone has a great night, and it's starting to get dark, but it's 7:30, so that's a good thing. It's staying a lot later. So everyone have a great night, and we will see you soon. Thanks so much.
Thank you very much. We
Thank you.
appreciate it.
Bye-bye.
Thank you.
All right, great job, guys. Thank you.
Thank you. If you have any follow-up or you need anything else, just give us a holler.
You know what, I will. And like I said, I'm going to break this up into two pieces because it was a little long, like the info and then the Q&A with all the links. And I think that will drive some questions. So yeah, awesome.
I'll share with you that Han number 38 in an email probably tomorrow.
Awesome.
And so that you'll have that available as well, so that they can see the direct Han from Dr. Chan and the latest guidance. So.
And on Friday, we'll see some national numbers from the educators about how many have had access to it and how many are getting back. And actually, I've seen some preliminary data. It's just been phenomenal change in even 35 days. So all positive stuff. And I don't think we're running into too many people who are hesitating anymore. So that's a good thing. This helps very much. Thank you so much.
Absolutely.
You're
Thank
quite
you.
welcome.
Thanks,
Have a great
Jim.
evening.
Thanks for being here on the short notice.
Thank you.
My
Very
pleasure.
much appreciated.
Welcome.
All right.
Take care.
Okay, have a good night.